Hello everyone, thanks for coming back to my channel. So today's topic, we're going to look at what are the nurse's responsibilities when a patient is taking corticosteroids like prednisolone, dexamethasone, hydrocortisone, and so many other medications that fall under this umbrella. So let's start with the nursing assessments. Our first assessment as nurses is to establish the baseline of a patient's blood pressure, fluids, electrolytes, their weight. The other thing, we have to closely monitor these patients for adverse reactions that we'll be talking more about in the second part of corticosteroids, and also assessing the effectiveness of the medication to ensure that it's doing what it's supposed to do, because we do not want the patients to be on such medications for a long time due to its effects, as I will be discussing that more in part B of corticosteroids. So the nursing interventions for medications like prednisone, it's good to administer these drugs early in the day to help mimic the circadian rhythm so patients can sleep well. Since these medications have a tendency of irritating the gastrointestinal system, it's good to give them with food. Patients have to take them with food. The other thing, they can suppress the patient's immunity. So we try to ensure that the patient is not exposed to any infection. And also the nurse has to ensure that the patient does not stop these medications abruptly. Any signs of severe or persistent adverse reaction should be notified to the prescriber immediately or to the doctor. And prolonged uses of corticosteroids is not advised, and it's not even good for the patient's health, especially in children. We try to not prolong these medications in children because they can cause stunted growth. So what are some of the nursing evaluations when the patient is on such medications? Is to ensure that there is no evidence of adrenal insufficiency, the patient has remained free of injuries, and the patient has no any signs of infections. As a nurse, you have to teach patients when they're on such medications, and these are the things that are very important to teach a patient. Patients should take this medication as exactly as prescribed, and never to stop these medications abruptly. Also, patients should be told to report any significant changes like increase in stress levels, black tarry stools, bleeding, blurred vision, change in emotion, bruises, and any other unusual effects. It's encouraged when a patient is on such medications to wear or carry a medical identification at all times. So in part B, I'll be talking about the indications, actions, adverse reactions, contraindications, and cautions of corticosteroids. So that's it for now. Thanks for watching my channel again. Subscribe if you haven't. Click the notification bell for new content that I will be uploading. Like my videos and do not forget to leave a comment, please. Stay tuned for more content.